Good day, this is Dr. Robert Morse, and this is an audio iris analysis for Zachary Goulet, and I'll spell the last name Goulet, and this is August 10th, 2017. Hello, Zachary. Let's see here, this is your, I generally just do the eyes, but let me just look real quick here at your questionnaire here. Eye floaters. Well, you know, a lot of times this is mucus, and you could use the eye wash and get up to about 12 drops in an eye cup. Wash your eyes out morning and night. You might get a lot of mucus out of your eyes, but also that, move your lymph system inside of your body. But that would be the best case scenario. The other case scenario is detached tissue and stuff. I grind my teeth at night. That's interesting. There's a lot of thought on that, of course. Parasitic and things like that, neurological. And at 20, 29, it can be either one. You do not poop very often, or you want to poop every day. So I have stomach and bowel number 0 through 5 now. If you poop every other day, use number 2. If you poop every 3 days, use number 3. And if you poop every 4 days or more, use 4 or number 5. You've got to get yourself moving every day. And that sounds neurological as well. There is another problem in your eye that does show that can be the lymphatic system. My hair is thinning a bit and recessed hairline. See, and that's all acidosis up in the head area. Not in my back under my right shoulder. Guess what that is? That's your lymphatic system. Again, this is the most dominant thing sticking out in your eyes. Look at this. You were following the O+ blood type diet for 2 months. I was told to eat high protein diet and raw fruits and veggies by the live blood cell analysis practitioner. I became constipated. For the last 2 weeks I have slipped and gone back to the old ways of coffee and cigarettes. Well, those are stimulants, of course, and that's going to help get you moving. That's the problem with that. But I'm still constipated. Yeah, definitely. Definitely want to get your nervous system up and running. Get on the fruit, the berries, and the melons. You got to clean your lymphatic system. That's what sticks out dominantly here. So let's go through your eyes here. All right. There's no question that your eye color's blue. Now, what's all the white that you see in the eye? Particularly about a ½ inch around the pupil, you have a thick white ring almost around the eye. What the heck is that? All right, so looking at 4 stages that the body goes through on its way from life to death. There are 4 stages of lymph congestion, you could put it in that way. There's 4 stages of dis-ease. There's 4 stages of diseases, if you want to use that philosophy. There's 4 stages that people look at in the processes of getting sick and going down the road to Hellville. The first stage is acute, and acute happens when you're sucking down on dairy products and things, and it's creating mucus in you. Now, this mucus is from the lymphatic system or the sewer system. The problem is your lymphatic system is already involved from mother. If it weren't, and let's say you had a clean body totally, no acidosis, no lymphatic stagnation, which is impossible because you get your mother's lymph system. And so, let's say that you did, and you had a mother and you were going to nurse, and your mother, of course, was going to breastfeed, and she loved acid ash food. She loved high protein diet. She loved protein, she loved your grains, she loved your cheeses, she loved all that. Well, that's acid ash forming food. So what that does is create an acid residue in the body, and that also can turn your fluids acidic, except for the blood. The blood will never be acidic and you stay alive longer than 3 or 4 minutes. So you're looking at a situation where the body has to defend itself against this acid milk. And of course these acidics are acids or proteins. And this of course creates a lot of mucus in the body, and this creates an acute condition. Cold and flu-like symptoms, things like this are acute conditions simply in the body's effort to get rid of what you just created. That's all it is. So the body's trying to detox itself, and medical doctors see that as some kind of bizarre thing that you caught walking around in the world of bacteriums and stuff and treat it. And of course, that set man up for serious problems using antibiotics and killing the bacteria in man, wrongly understanding what they're seeing. So all this condition sets these acute conditions up. And this starts the lymph stagnation, and it turns a blue eye white. And that's where all the white is in your eye. You're in an acute stage of lymph stagnation, but heavily so around the bowel wall. That heavy white ring you see around the pupil is your intestinal wall. So you're very malabsorbed. You've got a lot of malabsorption. And that also, by the way, as this acidosis sets in and becomes stagnant, it hardens things. This can harden the bowel wall, making a peristalsis even more difficult. But peristalsis is a neurological event and goes back to the adrenal glands. But the more you acidify the body, the harder it gets. Now, when you suppress these acute stages, they become subacute, and subacute turns a blue eye yellow. You're getting a little yellowing, particularly up in the sinuses, left side or right side, minorly so. But subacute, acute, who cares? You got to get it out. And of course, chronic is your third stage, and chronic, everything is hypo in the chronic stages. Everything goes hypo. In the acute, subacute, it can create a hyperthyroid condition, a hypothyroid condition, either one, hyper-hypo. But in chronic stages, everything goes hypo. Everything's going out and down and dead. So that turns a blue eye brown. So there's a lot of brown-eyed people out there that are actually blue-eyed people with chronic lymphatic problems. And then, of course, the final stage is atrophy or decay, which medical doctors call cancer, simply the atrophy decay stage, and that is turns the eye black, wherever that is. Pupils are a little small, but I think it's just systemic acidosis. I mean, that's about the average size that I see in most people anyway. Looking at constitution. Constitution deals with the genetics. Genetics deals with the cells, not the fluids. The lymphatic system deals with the fluids, even though the lymphatic system is made of cells. Imagine building a house all of wood. Your water pipes are fluid. Your electrical wiring is, your water pipes are wood. Your electrical wiring is wood. Your nails are wood. Everything's wood. Now, that'd be tough. The thing is, though, your body is made of cells exclusively. Everything is cells, no matter what, except for the two fluids that surface them, blood and lymph. So, looking at the genetics. Genetics doesn't mean always weaknesses. Genetics can mean strengths, and in your case, it means strengths. You have a good, strong body here genetically. You have your weaknesses. You have to get in and do some strengthening up, but who don't? But all in all, you got great, great, great genes. You might not feel it, but you do. And you'll be able to get yourself very healthy. You get the right focus going on, because you do have some issues that deal with how you stay healthy and get healthy. All right, so chemicals. The iridology is not a science for chemistry of the human body, but you can see sulfur blatantly. It turns a blue eye orange and a brown eye orange. And it's hard to see in dark brown eyes, but it's orange. And blue eyes, it's blatant. A lot of people have orange around the pupil. Heavy sulfur from sulfur drugs. Antibiotic use. Iodine in the blue eye is reddish brown. Spots like clouds over the eyes. All drug deposits and chemicals look like that. Malabsorption, of course, is you're into malabsorption. That thick white rope or ring you have around the pupil is following your intestinal wall. And for the most part, you're showing quite a bit of lymph stagnation in the wall. Common, but that creates IBS, Crohn's, tumors, polyps. I mean, this is sewer stagnation, acid stagnation. And nothing ever good comes from acids and acid stagnation, particularly. Now, malabsorption is one of the four. There are also 4 stages or phases your body has to go through to be healthy. Your body's basically a food processor with sensory factors. And processing food, the first thing you have to do is digest your food. So we'll look at your digestive system coming up here. The second is what? Absorption. You have to digest, but you also have to absorb what you digested. That's essential. Okay, so from absorption, what do you have? A few people know this one. And that's called utilization. If you think you have a zinc deficiency, you have to fix these 4 things before you can say that. And the third thing is utilization of, say, zinc, selenium, iron, and that all comes from adrenal steroids. Most of your minerals and sugar metabolism come from the adrenal glands. The adrenal glands are major glands for a whole bunch of things, and particularly the utilization of chemistry, except for calcium, which is a parathyroid hormone. So, utilization is a factor. Well, look at your glands coming up. And what's the fourth thing, do you think? Elimination. Proper elimination, not just in stooling, but in urination. And that means that your urine should have sediment in it. You should never pee clear urine. If you pee in a jar and it's clear, you're in trouble. That means your sewer system isn't filtering, and that means the sewage from the cells, which is quite a bit, and their acids are not going anywhere, staying in you. And that sets up the word inflammation. Circulation, good at this time. Looking at the digestive system, all right, let's take a look at there. All right, so we have a whopping gallbladder weakness, in my opinion. Now, it's not deep, but it is at the acute to subacute level with lymph stagnation around it, and that can just make it worse and worse and worse. All genetic weaknesses tend to have lymph stagnation around it, which is not good, is because of the reason they're weak in the first place. And it's ironic how it shows it. So you want to work on your gallbladder, liver. Liver looks pretty good, but the gallbladder is in a subacute stage of weakness. The pancreas is in an acute to subacute stage of weakness as well. And I would work on those two tissues because these the main digestive organ, of course, is the pancreas. And that could give you gassy, bloaty problems and undigested food material in your stools. So the liver gallbladder formula is excellent for both of those tissues. So I would use that one for a couple of months. Maybe use the pancreatic formula once in a while. It's for the fun of it. They're not deep weaknesses, but they are truly weaknesses that you have to deal with, genetically speaking. Now, looking at your small bowels and your colon, these are, you're basically in a subacute stage of weakness in your GI tract with some chronic weaknesses in places. Your ascending colon has some chronic weaknesses to it, several spots across the transverse, which is common. A few spots down the descending, but not a lot in the chronic levels, which is excellent. But you find that in your stomach. You have a lot of things going on in your stomach. You got chronic stomach, you got a little more, looks like a little degeneration going on there, maybe even some drug deposits. So you've got some stomach issues you got to deal with here. And I would avoid proteins. And I would go on a fruit, berry, and melon diet. You got to get this lymph moving anyway, and you got to restore the stomach. Be real careful what you put down the stomach. You want to regenerate your stomach tissue, which is easy to do. Now, I'm judging all this from the eyes that I'm seeing here, so just remember that. But your GI tract is definitely above average. You know, your lymph system that's about common. You have a lot of stagnation of lymph in the gut. People have a lot of gut problems, but it's interstitial. You have your weaknesses along that. Most of your weaknesses actually is the ascending, the bowel coming outwards from down below. Let's see. Rectally, I think you have a little subacute spot or two, but I think this other is your prostate. Now, looking at the head area, there are two nervous systems in the human body. Two nervous systems. There is the central nervous system, which is the brain. That is the physical link to the mind and the emotions, actually, the astral body. Then you have the worker bee. You have the autonomic. The autonomic has two sides to it, sympathetic, parasympathetic, push-pull. This is the worker bee, I call it. It makes everything happen. It makes your bowels move, your heart pump, your lungs breathe, all of those goodies. And this comes in at the back of the head, cerebellum, picks up the mastoid, picks up the optic nerve so you can see. This is a major nervous system. So when you taste, smell, see, hear something, it actually registers through the autonomic to the central nervous system, the brain. The brain then is the physical link to the mind and emotions. So you start leaving the physical world at that point and entering these etheric bodies of yours. Your emotional starts recognizing either the taste, the smell, the sight, or whatever. Your mind then is nothing but a huge library. So it has categorized all your experiences in the past. So it's searching for like experiences or not to work the fight or flight syndrome. All this is done in an instant. Working several bodies all at one time. Pretty slick. Pretty slick for the Creator. So, looking at the autonomic, I don't really see any really nerve rings, dude, and that is pretty dang good. So, and you're above average. You look at your adrenal glands real quick, because that's where your autonomic nervous system gets its neurotransmitters. Now, get this. The brain of the autonomic is your stomach. So you could be having autonomic nerve problems from the stomach affecting your bowel movements. Oh, absolutely. So I would say that it's hard to determine your autonomic when you don't see nerve rings, because nerve rings is an indication of chronic. You have one area of chronic nerve weakness which goes through your lungs, and this could create a little asthmatic issue, but minor in my opinion, considering the strength of your genetics and stuff. So you have to say your autonomic is between acute and subacute. Follows where your adrenal glands is, has been my experience, and so your adrenals are in about a subacute stage, and that would be about the same. Now, your central nervous system, this is important because you have some things here you have to think about here, and this is the head area, and you're losing, like you said, a hair and receding hairline. That you got to stop, because that's acidosis, and that, of course, then gets into the brain, which is already, and then that sets up for a lot more serious issues. The suppression of thought, function of all levels. And, of course, the endocrine glands because of the pituitary. So looking at the right side of your head, you have a chronic pituitary weakness, and my man, you want to fix that. Upper circumbrain and nerve are two good formulas for you. The pineal gland is your rest and spiritual gland. That's in an acute to subacute stage of weakness genetically. You have another spot, the back between the midbrain going to the back of the head. You got some chronic things going on the right side. And then when I hit your cerebellum, I'm in the light side of chronic. And the mastoid of the right ear is in a subacute stage of weakness. So you've got weaknesses in the cerebellum mastoid, which is equilibrium, dizzy, vertigo, swinging blood pressures. Not a fun place to have weaknesses. And of course, that's where the autonomic comes into the head. And the optic nerves cross. Looking at the left side, you have a lot more sinus involvement, a lot more lymph stagnation, I think, on the left side of the head, but less weaknesses. I get back to your cerebellum, and you have less weakness there, but it's still a weakness. That's in a subacute to acute weakness there. The mastoid is a little more involved, and the left ear tends to be more involved. Either we're looking at a little chronicness to your left shoulder, or you have a chronic left ear, and I'm going to put my thing more to the left ear. Right ear, you just have a lot of congestion in that area, and more of the mastoid involvement there. So upper circumbrain and nerve, but you're still, I hate to tell you, well above average, my man. Now, brain circulation is good at this time. Looking at the endocrine glands, now this is where utilization of chemistry comes in, but everything else, because these are the bosses. So would you always work on them? You would always work on them. Your right adrenal gland is in a subacute stage of weakness genetically. Your left adrenal gland is in a subacute stage of weakness genetically. Your right side of your pituitary is chronic. Your left side is in an acute, heavy lymph stagnation around your pituitary. Be careful. Lymph stagnation equals cysts, tumors, that sort of thing. Boils, pimples, that sort of thing. Your right thyroid gland, hard to see it all because of your skin ring, but it looks like you have some weakness, hard to tell. I'm going to leave that open. I'm going to say it looks like, but there is a lot of lymph stagnation in the thyroid and also in the parathyroid. Looking at the left thyroid gland, you have a subacute stage of weakness in that, and your parathyroid is got a lot of lymph stagnation and maybe just a tad bit of a subacute weakness there as well. So you can work on your endos. You have to work on your pituitary. That controls all the other ones. And so when you want to work on your parathyroid or adrenals or whatever, think about the pituitary. So endocrine gland formula and adrenal formula would be the two I would use. Looking at the skin, you have a skin ring all around your body, dude, even on the head. So it's showing that you have weak skin. Skin is the largest eliminative organ of the human body. When you say eliminative, you don't poop from your skin. So what's the other elimination? Systemic metabolitic wastes, acids from the cells. These are cellular wastes, not digestive wastes. And that's where you're having problems, where everybody's having problems. And the blowback is on every system in the body, because the sewer system surrounds every system, every cell in the body. So you have a little bit of a skin weakness all around the body, and you just have to get the thyroid up and get yourself sweating, maybe use some dry skin brushing and stuff like that, but get your body alkaline and breathing. That repairs and regenerates. Talking about the lymphatic system, that's all the white you see. The thicker the white, the heavier the lymph stagnation. And that has to clear up. All that white has to come out of there and get your nice blues back. Looking at your appendix, I'm going to say your appendix is heavily lymph stagnation in there. It's a good way to lose it. And probably in a subacute to moving to the chronic side of weakness. Your lymph system is in an acute stage. Yeah, spleen-wise, you look pretty good there, I think. Don't see too much going on. Maybe a little subacute weakness here. Now, male, you've got to, on the right wall of the prostate, you have some genetics and a lot of lymph stagnation, and on the left wall, you have some genetics as well, at the subacute to minor chronic. So be careful. This is another area that can affect you. Low testosterone with the adrenals and the prostate together. Don't want to take it. Make serious problems. You want to fix it. But fixing the kidneys and getting them filtering is how you fix the prostate and everything around it. But you can also use down the road male reproductive herbs to strengthen the prostate. But I would get the lymph moving first before I would get my body too involved with tonics like that. The right testicle has some chronic weaknesses in it, and the left testicle has a spot or two as well. Looking at the respiratory system, there's 3 lobes of lungs on the right side and 2 lobes on the left. Now, here's some mucus building up in the lower lobe and the mid lobe a little bit. That could come out of there. I don't see any major weaknesses. Maybe a little in the upper lobe. You have some acute weaknesses a little bit on the right side. Left side, I just see a little mucus building up in the upper lobe. Bronchial trunk-wise, same thing. You got a little subacute weakness here and there, especially in the right side. It feeds the upper lobe. But those are minor weaknesses. Got some congestion there, and that'll come out. Looking at the urinary tract system, this is what you want to look at. That's your kidneys. And, of course, that's bumps with the adrenals, and that's serious. You got to work on those. And this is where some of your genetics come in as well. You have a little bit of a light chronic kidney on the right side. You really want to work on that kidney and adrenals. That's real imperative to make those healthy and to get them filtering. You also have a genetic kidney on the left side as well, but only at the acute to subacute level. But they still have weaknesses, so strengthen them. Strengthening in the body, 2 sides of chemistry. So wouldn't it make sense that one strengthens and one weakens? They're polar opposites. You can't have chemistry and have 2 sides of life both the same. They have to be polar opposites. And so acids break down, alkalis build up. It's a natural rhythm. So that's why the diet is imperative. Add a little juice called electricity, and you're talking about raw foods now. Now, to end your iris analysis, let's look at the skeletal system, and this is the parathyroid, and in your case, you can also say pituitary. So here again, I think I see a lot of above average stuff here. Looking at the right side of your spine, you might have a little throat going on both sides, particularly the left side, so you might get a little sore throat during detox. But the upper neck, I'll just go on both sides and look at it. The upper neck, what we have on the right side is a little bit of a chronic upper neck, light side basically. I'd say the upper C-spine on the right side, you have weaknesses all through the C-spine, basically in the subacute, maybe like chronic. On the left side of the neck, much more involved. A lot more to the chronic side in the C-spine. On the left side, move from the C-spine going into the T-spine, you're moving out of a little bit of chronic, but you're still heavy subacute, going into light chronic. So that upper back, particularly on the left side, is involved. Right side much better in the T-spine. Minor. When you get out of the lower back, that's your kidneys, lumbar, bladder, prostate, and stuff. You pick up a little bit. You pick up a tailbone weakness here on the right side, and a little of a subacute weakness in the lower back. On the mid-back on the left side, you get a little subacute weaknesses. That's still in the T-spine. Entering the lumbar spine, you're looking better than the right side. Now, I didn't talk too much about your bladder. While I'm thinking about your bladder, let me look at that. That went with your kidneys, and I see a lymph stagnation in your bladder and some subacute weaknesses on the bladder wall. Sorry about that. Pick that up there. Interject. That's with these audios, you don't know what you're going to get. Could get my dogs barking even. Yeah, it's early in the morning. I don't know, what is it, 5 o'clock? Now, let's look at your right side here for a minute. The right leg is weak genetically. The whole leg and the groin and the hip genetically involved. to the chronic side, by the way. Right leg, right hip, and right groin. So all of those are potential problem areas, and particularly the right groin. Be careful how you lift and stuff. Start shrinking connective tissue and stuff, and that goes through the parathyroid, pituitary, of course. Looking at your shoulder on the right side is in a subacute state, definitely genetically weak. Your skeletal system seems to show some weaknesses in places. Doesn't mean that you have a parathyroid weaknesses, but I would assume that and work on that a little bit. Looking on the left side, the leg is much better. You have around the knee area, you have some inflammation and stuff, more to the lower leg. Upper femur, I would say just a lot of inflammation up in there, lymph stagnation. Same with the hip. You got a lot of lymph stagnation in the left hip, so a lot of inflammation there. A little bit of a groin weakness on that side, not too bad. And the shoulder starts out with some chronic weaknesses, but gets better as you get up or down. All right, my man, that should take care of you. Have fun, dig in. You got a cool body to get well, but you got places you got to deal with. All right? All right. Thank you, my friend.